My name is Christy Kahl, Editorial Director of Cure Magazine. In this edition of the Speaking Out video series, on behalf of the National Pancreas Foundation, we're talking with Dr. Eileen O'Reilly from Memorial Sloan Kettering Cancer Center about the basics of pancreatic cancer. Hi and welcome.
Hi, Christy. Nice to be here today. Thank you.
Yeah, thank you. So to start, can you just explain the pancreas and how this type of cancer begins?
Certainly. So the pancreas is an organ that sits in the back of the abdomen. It's sort of a banana-shaped organ in the midline over to the left. And it has two major functions. It produces a variety of hormones that control blood sugar, the main one being insulin, but also others. And it produces some enzymes that break down and digest what we eat. So they're the two main roles of the pancreas. Most people aren't so aware of this organ until it's affected, either with diabetes, inflammation, pancreatitis, or indeed cancer.
Okay. And what is the rate of pancreatic cancer diagnoses each year in the United States?
So about 58,000 people will be diagnosed with pancreas cancer in 2020. And we've seen a steady increase in the incidence of this disease over the last number of decades, about 0.5% increase per year. And that's a worrisome trend. It's a disease of older people, but the other kind of worrisome trend is the incidence in older people is flat, but we're seeing an increase in incidence in younger people. And that may be partly related to some lifestyle considerations related to diabetes and related to obesity.
Okay. And so can you just discuss the types of pancreatic cancer, like how there's exocrine tumors or what we call PNETs?
Yes, indeed. So there are a number of different types of pancreas malignancy. The commonest is adenocarcinoma, or how most people refer to as pancreas cancer. And adenocarcinoma rises in a duct, or a gland. And adenocarcinomas can rise anywhere in the body, but a major percentage of pancreas malignancies are adenocarcinoma. The next commonest type is neuroendocrine cancer, and they tend to be a little different in their behavior and sometimes more slow growing and can exist over a very extended period of time. And then there are a number of rare types of pancreas malignancy that are a couple of percent or less, and treatment and how they're approached is individualized, but they're mostly addressed from the surgery perspective.
Okay, great. And then, with the different types, there's also stages. Can you just discuss a little bit about the different stages of pancreatic cancer?
Sure. So pancreas cancer, there are two stages. There's what we call clinical staging, and there's pathologic staging. And to explain that, clinical staging is how we interpret the disease when a person hasn't gone to the operating room. So a person with localized pancreas cancer confined to the gland that's amenable to an operation would be potentially operable or resectable. The next stage is stage 3, which is locally advanced, meaning involving key blood vessels, but not operable. And stage 4 is metastatic disease, with the common areas of spread being liver, lung, inner lining of the abdominal cavity, lymph nodes, and then rarer systems like the bones. So that's clinical staging. Pathologic staging applies to those who undergo surgery, so where one has the opportunity to examine the tissue directly. And there we look at the size of the tumor, whether there are lymph nodes involved, and then the stage in that context. So most people who undergo surgery and have their cancer removed will have either stage 2, that's most common with lymph node involvement, or sometimes stage 1.
Okay. And so in a previous series before this one, we talked a lot about screening and trying for early detection. That leads into my next question. pancreatic cancer is often diagnosed at an advanced stage, unfortunately. Why is that?
Yes, so this is, a very common and a very important thing. Pancreas cancer, as we often discuss in the clinic, is the ultimate sneaky business, right? In terms of how it manifests. It's relatively silent until it has reached a critical mass in the body and causes symptoms. And we have models to suggest that the first cancer cells develop many years prior to the onset of symptoms. And symptoms, when they do occur, can be, for some people, relatively non-specific and not point in a specific diagnosis direction. For others, they can prompt medical attention. And so to explain that a little further, tumors that arise in the head of the pancreas, which is the commonest area, tend to cause jaundice because they block the bile duct, and that causes yellowing of the eyes, sallowness of the skin, dark urine, and sometimes itching, and that will prompt people to seek medical attention. Whereas tumors that are in the body or the tail, so to the left side of the midline, it can be annoying or an intermittent back discomfort, sort of subtle changes in appetite and energy, but often not as big a prompt to seek evaluation, and that may be part of it. The biology of this disease, how these cells grow and develop, is also part of this, that these cancer cells can have a high propensity to early spread relative, for example, to other cancers. And that may be part of the reason when we do diagnose it, that for many, the cancer is not amenable to surgery. Certainly treatable, but it's either involving blood vessels or has spread beyond the pancreas.
Okay. So with that, and how this disease is unfortunately diagnosed at more advanced stages, why is it so important then to raise more awareness around pancreatic cancer?
Thank you for this question. It's a really important question, and advocacy organizations such as the National Pancreas Foundation, National Pancreas Foundation, serve a major role here in highlighting this disease and increasing awareness about this cancer, highlighting the symptoms that an individual can present with, and to encourage them to seek medical attention. I think highlighting that this cancer may not be curable for many, but it is treatable. And that's an important message to emphasize, because there's typically a lot of understandable nihilism regarding treatment of this disease, and that's something that we really need to change. And that in particular, if this cancer can be diagnosed early, and we already know this, that earlier diagnosis improves outcome. So awareness, prompting assessment with symptoms, especially for subgroups of people that might be more at risk for this disease, is likely to impact outcome. And I think the other reason the National Pancreas Foundation plays a very important role is that having more people focused on this disease in terms of research, right, will help improve outcomes, and just raising awareness, funding, extremely key considerations.
Absolutely. Well, thank you so much.
Great. Thank you.